This is the humerus bone. So when we talk about the humerus bone, you will find it is a long bone. Okay, long bone. It has the two ends, upper end, lower end, and shaft. Okay, so upper end, lower end, and shaft. It is a right-sided humerus bone. It is a right-sided because the upper end bears a head which is directed upwards, medially, upwards, and backward. Medially, upwards, and backward. So it is the upper end. And it is directed to medially upwards and backward. Lower end is expanded to form the epicondyles, side to side to form the epicondyles. Okay, so lower end is expanded, upper end bears a head which is directed upwards, medially, and backwards. Okay, and posterior part of the lower end bears a fossa that is called as olecranon fossa. So by these 3 points you can rule out that it is the right-sided humerus bone. Okay. Now, when we talk about the upper end, you will find the head which articulates with the glenoid cavity of the scapula. Okay, glenoid cavity of the scapula. This is the left side. So, glenoid cavity of the scapula, head is articulates with the glenoid cavity and form the shoulder joint. Okay. Head is separated from the rest of the upper end. Rest of the upper end, say ये head जो है separate रहेगा, separate by a line that is called as anatomical neck. So you will find a line which separates the head from the rest of the upper end that is called as anatomical neck. Okay, so this is a line which is called as anatomical neck which separates the head from the upper end, rest of the upper end. And the line, imaginary line which separates the upper end from the shaft is called as surgical line. So you will find here is the imaginary line which separates the upper end from the shaft. So that is called as surgical neck. So 2 necks are there. Okay, so first of all we have seen the head and anatomical neck and surgical neck. At the upper end you will find the 2 bony tubercles that is called as greater tubercle. Large tubercle is called as greater tubercle. It is found on the lateral side. Okay, and at the anterior side you will find a lesser tubercle, which is small tubercle, that is called as lesser tubercle. So 2 tubercles are there, lesser tubercle and greater tubercle. There is a sulcus in between the 2 tubercles that is called as intertubercle sulcus, or it is also called as bicipital groove. Okay, fine. Now when we talk about the greater tubercle, you will find the 3 impressions here. So at the topmost you will find the upper impression, in the middle you will find the middle impression, at the lower part of the tubercle you will find the lower impression. Upper impression, middle impression, and lower impression. This is meant for the attachment of some muscles, okay, insertion for some muscles, okay, we'll talk about later. Now what we have seen in the upper end, we have seen the head which articulates with the glenoid cavity of scapula, from the shoulder joint, anatomical neck which separates the head from the upper end, and surgical neck which separates the upper end from the shaft. And we find the two types of the tubercle: small tubercle, lesser tubercle, large tubercle, greater tubercle, and the sulcus between them that is called as intertubercle sulcus or bicipital groove. We have also find the 3 impression on the greater tubercle, that is the upper impression, middle impression, and lower impression. Done. So upper end is done. Now we come to the shaft of the bone. So we will find the shaft has the 3 borders and the 3 surfaces. Okay, so you will find the shaft is 3 borders and 3 surfaces. So you will find the anterior border, medial border, and lateral border. Here you see anterior border is continuous at the lateral lip of the bicipital groove. So when we talk about the bicipital groove has the lateral lip, medial lip, and floor. Okay, 3 parts of the bicipital groove: lateral lip, medial lip, and floor of the. So anterior border, you will see that the anterior border continues as a lateral border of bicipital groove, और bicipital groove का lateral lip है वो anterior border में continue हो जाता है, join कर लेता है. Medial lip of the bicipital groove continues as the medial border of the bone. तो medial border जो है it is continuous with the medial lip of the bicipital groove. And you will find that here is a lateral border also. So 3 borders are there: anterior border, medial border, lateral border. 3 surfaces will be there: anteromedial surface, anteromedial surface, anterolateral surface, and posterior surface. So anteromedial surface will be between the anterior border and medial border. Anterolateral surface will be between the anterior border and lateral border, and posterior surface will be between the medial border and lateral border. Okay, posterior surface. Now we come to the lower end. Lower end is expanded and it forms the two epicondyles. So medial and lateral epicondyle. So you will find that the medial epicondyle is more prominent than the lateral one. At the lower end you will find a rounded part that is called as capitulum, articulates with the head of the radius bone. This is the radius bone. So this is the head of the radius bone. Capitulum articulates with the head of the radius bone and form the elbow joint. है ना? क्या बनाएगा? Elbow joint बनाएगा. And a pulley shaped structure that is called as trochlea articulates with the trochlear notch. Here is the trochlear notch in the ulna. This is the trochlear notch of the ulna. It articulates with the trochlear notch of the ulna and forms the elbow joint. This is a compound joint. Okay, so more than two bones are joining here. So one is the humerus and one is the radius and ulna. Three bones are joining here. So the elbow joint is a compound joint. More than two bones. Okay, so you will find the capitulum, which articulates with the radius, trochlea articulates with the trochlear notch of the ulna and form the elbow joint, and just above the capitulum you will find a fossa that is called as radial fossa because it articulates with the radius. Radius is on the lateral side. So radius is on the lateral side. So the capitulum, just above the capitulum you will find fossa that is for the accommodation. The fossa is for the accommodation of the head of the radius, so that is it is called as radial fossa. On the flexion of the elbow joint you will find the head will accommodate here at the radial fossa. Okay, so this is the radial fossa. At the ulna you will find a process, two processes are there, coronoid process and one is olecranon process. When the trochlea articulates with the trochlear notch, there is a one fossa just above the trochlea, and which is for the accommodation of this process that is called as coronoid process. So this fossa is also called as coronoid fossa. So at the anterior side of the lower end you will find the two fossas just above the capitulum, radial fossa, just above the trochlea you will find the coronoid fossa. The behind one large fossa is there for the this process of the ulna that is called as olecranon process. To accommodate this process, this fossa is called as olecranon fossa. Olecranon fossa. During the extension of the elbow joint, this olecranon process will accommodate this olecranon fossa. So at the lower end you will find the three fossas: capitulum just above the capitulum, radial above the trochlea, coronoid behind olecranon fossa. Three fossas are there. Done. Bony projection, medial epicondyle, lateral epicondyle, capitulum, trochlea, radial fossa, coronoid fossa, olecranon fossa. Done. Just above the epicondyles there is the sharp border, sharp lateral border that is called as lateral supracondylar ridge. Medial border just above the medial epicondyle that is called as medial supracondylar ridge. This was all about the features of the scapula. And at the posterior surface, okay, one more thing is there. There is a tuberosity on the lateral side that is called as deltoid tuberosity. Okay, at the lateral surface you will find a tuberosity that is called as deltoid tuberosity. Posterior surface, at the posterior surface you will find a groove which is from the going downwards from the medial side to the lateral side, that is called as radial groove. This is for the accommodation of the radial nerve. Okay, so radial nerve will pass from the posterior surface from medial to the lateral side in the groove that is called as radial groove. So at the posterior surface you will find the radial groove. So this was all about the features of the humerus. Now we'll discuss about the muscle attachment. When we talk about the muscle attachment, we have already discussed that the lesser tubercle you will find the insertion of subscapularis. Very good. This is the insertion of subscapularis. Okay. Now we have already discussed about the three impressions on the greater tubercle: upper impression, middle impression, lower impression. Upper pay, supraspinatus, infraspinatus, teres minor muscle. Okay, so 3-4 muscles are there. We have already talked about the bicipital groove or intertubercle sulcus, which has lateral lip, medial lip, and floor. Okay, so three parts are there at the bicep. So at the lateral lip there is a insertion. You must remember that the upper half of the bone, of the shaft of the bone, will give the insertion. Lower half part of the bone, lower half of the bone gives origin of the muscles. Okay, so no need to remember whether the muscle is originating or insertions there. So see, this is insertion. This is the origin point. Now, lateral lip of the bicipital groove gives insertion to the pectoralis major muscle. Medial lip major, teres major. So medial and lateral lip will be the major. And in between the floor there is a latissimus dorsi. Okay, so two majors are there and one is latissimus dorsi. Lateral side में pectoralis major है because pectoralis L is there. So okay, so L is for lateral side. So no need of confusion. In pectoralis lateral lip है pectoralis आ जाएगी, teres major, latissimus dorsi. Deltoid tuberosity gives insertion to the deltoid muscle. So you will find the insertion of the deltoid muscle on the deltoid tuberosity. This was all about the insertions. Okay, now we talk about the origins. Lower half of the anterolateral and anteromedial surface gives origin to the brachialis. Okay, so brachialis muscle. So large origin is there. The lower half of the anteromedial surface and anterolateral surface gives origin to the brachialis muscle. So here, from here, this is anterolateral surface, anteromedial surface. So brachialis muscle will be originated from. Now we talk about the supracondylar ridges. So when we talk about the lateral supracondylar ridges, so that is the origin of muscles, that is brachioradialis and extensor carpi radialis longus. So it is divided into the upper 2/3 part and lower 1/3 part. Lateral supracondylar ridge is divided into the upper 2/3 and lower 1/3. Upper 2/3 part gives origin to brachioradialis. Okay, brachioradialis, upper 2/3, and lower 1/3 parts gives origin to extensor carpi radialis longus. Extensor carpi radialis. So done. Brachioradialis and extensor carpi radialis. And lateral epicondyle gives origin to common extensor origin. So you will just remember only that here the many muscles are originated from the lateral epicondyle, that is responsible for the extension. Okay, so muscle will go from the elbow joint to the back side of the arm. From here the muscle will go like that. So these muscles will be responsible for extension. Back side this muscle will contract. क्या करेगा? Extension. Or from the medial epicondyle the muscle will go like that. क्या करेगा? Flexion. So here what is? It is the common flexure origin. Here you will find the common flexure origin. Here you will find the common flexure. Here you will find the common extensor origin. Done? Clear? चलिए. Medial supracondylar ridge gives origin to pronator teres. Medial supracondylar ridge is pronator teres. So we have seen the five muscles. Okay, what sorts of muscles is there? Upper 2/3 part of the lateral supracondylar ridge, brachialis. Lower 1/3 part. Brachioradialis. Sorry. Brachioradialis. Okay, brachioradialis. And lower 1/3 part is extensor carpi radialis. Medial supracondylar is pronator teres. Medial supracondylar gives origin to pronator teres, and this is the extensor of common extensor origin. This is the origin of common flexure origin. 5. Okay, and one muscle is on the posterior surface of the lateral epicondyle. There is a origin of anconeus muscle. ठीक है? This was all about the origin. When we talk about the posterior surface of the humerus, posterior surface is divided into the lateral part and medial part. The small lateral and large medial part. So lateral part में आपको एक ridge मिलेगी देखने के लिए. So यहाँ पे आपको कौन सी muscle origin होगी? Which muscle which originated from the posterior surface? There is a Which muscle is here? This is the biceps. This is triceps. Very good. So triceps will originates from the posterior surface of the humerus. Okay. So triceps, how many heads will be there? Three heads. So two heads. One head we have already discussed. कौन सा head? Which head we have discussed? Long head of the triceps originates. One head we have already discussed. Long head of the triceps. Now there are two heads remaining. Okay. So there is a medial. This is the lateral part. No? This is the, because greater tubercle is on the lateral side. This is the medial part. So one groove is there, which that is called as radial groove. Very good. So radial groove is meant for the radial nerve. So one groove is divided into the lateral part and rest of the medial part. So lateral head of the triceps originates from the ridge just above and lateral side of the groove. रेडियल ग्रूव के लेटरल साइड और जस्ट उसके ऊपर से लेटरल हेड ऑफ द ट्राइसेप्स और यहाँ से मीडियल हेड ऑफ द ट्राइसेप्स ऑफ द पोस्टीरियर सरफेस गिव्स ओरिजिन टू द मीडियल हेड ऑफ द ट्राइसेप्स. सो ट्राइसेप्स के दो हेड्स हैं जो कि पोस्टीरियर सरफेस से निकलेंगे, ग्रूव के ऊपर से लेटरल हेड, ग्रूव के नीचे से मीडियल हेड ऑफ द ट्राइसेप्स निकलेंगे. डन. दिस वाज ऑल अबाउट द मसल अटैचमेंट ऑफ द ह्यूमरस. डन. सो and when we talk about the clinical anatomy, so you will find that the surgical neck is the weakest point of the bone. So whenever there is a strike or injury will cause the fracture at this point only. Okay. So this is the weakest point, that is the surgical neck of the. Supracondylar fracture is also in the young peoples. यहाँ पे supracondylar ये वाला fracture होता है, तो इसमें ये वाला जो पोर्शन होगा ये पीछे निकल के चला जाता है. ठीक है. So this was all about the clinical anatomy. ठीक है, best. Thank you.